Hi there, I'm Lucy Macdonald, physiotherapist. Welcome back to my virtual clinic. Today I'm going to be talking to you about what is causing your knee pain. But before I do, I'd like to say thank you so much for all of your supportive messages. I really appreciate them. I'm so glad that so many of you have been finding this series on keeping you and your family healthy at home so useful. Before I go any further, please do press the big red subscribe key and make sure you've watched the last 2 videos in this series on when is knee pain an emergency and how you can manage your knee pain yourself at home. So, first of all, introducing you to this plastic model of a knee. Now you can see here that you've got the 2 main bones of your thigh and your shin, and then underneath here you've got your kneecap. Now your kneecap is really important for the function of the knee, and your kneecap glides up and down through this lovely notch underneath the knee here. I'm going to remove the kneecap for a minute. Now you can see inside the knee here you've got these blue things that obviously aren't blue in your body, but they are your meniscus, which are like moon-shaped cartilages, so soft tissue which really helps the knee function properly, bit of shock absorbency, and helps it to bend and straighten. Where you can see here, this shiny bit, this shiny area, this is all covered in cartilage, which again helps with the lubrication and the smooth running of your knee joints. You can see deep inside there, those are your Acl and Pcl ligaments inside the knee. And then if we close the knee back up again and look at the sides, you've got your lateral collateral ligament on the side there and your medial collateral ligament on the other side. And all of those ligaments stop the bones from falling apart, basically. On top of that, you've got all sorts of things like your tendons, which hold the kneecap down to the bone below, and where the muscles attach down through your quads muscles and into that kneecap, into the tendon before it goes into the kneecap. And then you've got your shin muscles coming up at the front. You've got your hamstring muscles coming down at the back and inserting just below the knee at the back, and then you've got your calf muscles coming up through your calf, one of which inserts above your knee. So lots of muscles enabling you to do all those fabulous movements with your knee, but also mean that they can all become injured depending on how you use your knee. So you can get injuries to any of those structures. You can get injuries to the cartilage, the meniscus, the tendons, the ligaments. You can get injuries to the muscles, the nerves, the blood vessels, all sorts of other things that you can't see on here. Now, sometimes people say to me, oh, I have pain at the front of my knee, what's causing it? Or, oh, I've got pain at the back of my knee, what's causing it? It's very unusual that by just telling me whereabouts your knee pain is, that I can work out what structure it is, just because there's lots of things going on in the knee. You can also get referred pain to the knee from locations like your hip or your back. So there's all sorts of things that I need to check to make sure I'm making a clear diagnosis of what's going on with your knee. However, there are a few generic things that you can do to help manage your knee pain, irrespective of what specific structure it is that's causing the pain. The most common cause generically of knee pain is that you're overloading the knee more than it's used to. So in other words, you've suddenly increased the amount of walking or running or lifting or carrying or whatever it is, some activity that you've suddenly increased, or that you've just slowly but surely let your knee muscles become weak, so that your quads muscles, your hamstrings, your calf muscles have all just become very weak, and therefore some of the structures of the knee joint itself are taking too much load. So the answer to long-term management of the knee, please do watch my previous video, but it does come down to strengthening and getting the alignment of the knee right. That brings me on to the topic of my next video, because I'm going to tell you my favourite exercises for your knee. So if you have knee pain and you want to know what exercises you should be doing, please do watch my next video. So press that big red subscribe key, and I will see you next time. Bye.